There we go. Okay, welcome to Thursday evening breathing buddies. We are going to start with an exercise to help open up your airways. This is for clearing nasal congestion. This is a really useful one for this time of year. And for some people, just generally, if you've got allergies or if you just find yourself congested quite a lot. So the instruction for this, we're going to do it a couple of times, 2 or 3 times, is you're going to breathe in through your nose, then out through your nose. Then you're going to pinch your nose. When I say pinch your nose, don't squeeze together because that can kind of disrupt the breathing once you let go. Just kind of cover your nostrils and nod your head. So you're going to hold your breath and nod your head. And you're going to do that until, if you're in good health, you'll do it until the first moment when you feel like you need to take another breath. Sorry, I'll say this again. If you're not in the great health, sorry, if you have any kind of serious health conditions, if you've got heart disease, hypertension, diabetes, if you've had a stroke, recent surgery, if you suffer from panic disorder, you know what I mean. If you're just kind of not in 100% health, do this until you get the first urge to take a breath. Then just take a breath through your nose. If you're in good health, keep going for as long as you can until it gets really kind of quite the air hunger gets really quite strong. Then breathe in through your nose, and hopefully you'll find your nasal passages are clearing after the first round. So we're going to breathe in through our nose, then out through our nose, then pinch your nose, hold your breath, nod your head until you either feel the need to take a breath if you're not in at 100% health, or just keep going as long as you can, then breathe in through your nose. We've got some excellent breath holders here today. Fantastic. Now, hopefully, you feel a little bit less congested now if you felt congested before. Whenever we do something like this and we've held our breath for a long time, we've let carbon dioxide, the concentration of carbon dioxide build up in the blood, and we need to just kind of let everything settle a little bit before we do it again. If we don't do that, you'll find that when you do the exercise again, if you do it straight away, you won't be able to do it for as long because the primary driver for breathing is carbon dioxide. So if the carbon dioxide levels are already high in your blood, you won't be able to hold your breath for as long before you feel like you need to take another breath. So we just kind of let things settle for a little while now. Then when we're ready, take a breath in through your nose and out through your nose. Pinch your nose, nod your head. If you're in good health, keep going as long as you can. If you're not in such good health, just stop at the first sign that you need to take another breath. When you're ready, breathing in through your nose. Right, hopefully you're breathing a little easier now. We're going to get down to the practice. So let's start with a bit of a checking-in session. One hand on your chest, one hand on your belly, just above your belly button, around your diaphragm. If you feel comfortable, close your eyes for a second. Don't change anything about your breathing right now. Just breathe and get a sense of how you're feeling right now. This is just so we can reflect back on this at the end of the session, because after all, this is all about how it makes you feel. How are you breathing now? Which hand is moving most? Is it the hand around your diaphragm? Is it the hand that's resting on your chest? Is it a bit of both? Don't try to change it. Just notice how it is. Have you carried some of the stresses and strains of the day into this session? How do they feel? Is there a kind of feeling tone that you might be able to describe how you're feeling right now? Something you might be able to to reflect on later. Now we'll move into the first exercise. So without changing where your hands are, I want you to concentrate on your breath as it is right now, breathing through your nose, if you can. Feel the slightly cooler air as it enters your nose, slightly warmer air as it leaves your nose. And notice the pace at which you're breathing. Feel your hands moving with each inhalation and each exhalation. So again, noticing the slightly cooler air as it enters your nostrils, slightly warmer air as it leaves your nostrils. Now the instruction for this exercise, which is called breathe light, it's quite a simple instruction. It's to breathe a little bit less air. But this is quite a tricky thing to do, and you have to kind of work out your own method for doing this. So maybe aim to breathe, or to inhale maybe 70% of the air that you would in a normal inhalation. You might have to slow your breathing down. Perhaps you can just control the diaphragm so less air gets in. If I was sat with you, if we were in the same room, I'd be saying to you to try and hide your breath from me. So that's both in terms of me being able to see you breathing, but also in terms of me being able to hear you breathing. So we're looking to breathe very lightly, very quietly. You can use this exercise as a measure of your concentration. For how long can you keep your mind on the idea of breathing just a little bit less air than normal? And you're searching for this feeling of air hunger. Tolerable amount of air hunger. If you've not found the air hunger yet, try and breathe a little less air once again. Can you get to the point where even the tiny hairs in your nose have stopped moving? Now, once you've found the air hunger, you need to ride with it. If you start to feel that your breathing is becoming a little jerky, a little uncontrollable, then you've maybe gone a little bit too far. This should be a tolerable feeling. But if you've not found the air hunger, well, maybe one thing you can do, you can try, is just to cover one nostril. When we breathe lightly, when we breathe a little less air, we allow carbon dioxide to accumulate in the blood. The concentration of carbon dioxide increases. We sometimes think of carbon dioxide as being the waste product. Oxygen good, carbon dioxide bad, but it's much more complex than that. Carbon dioxide is absolutely vital for oxygen delivery to muscles and tissues. It's the catalyst that allows hemoglobin to release oxygen to your muscles and tissues. It's also a vasodilator. When you allow carbon dioxide to increase in your system, it causes blood vessels to dilate. You get better delivery of blood and therefore oxygen to your muscles and tissues, including your brain. And this helps us to feel calm and focused. You may also notice your hands and maybe even your feet getting a little bit warmer, because we have dilated blood vessels throughout the body when we carry out this exercise. So again, concentrating on slightly cooler air as it enters your nostrils, slightly warmer air as it leaves. Now, without opening your eyes, if you've got your eyes closed, just drop that exercise for a second. You can rest your hands on your lap just for a moment. Just let your breathing fall into a natural pattern. Now we're going to do the second exercise, which is called Breathe Deep. So what I'd like you to do now is to take your hands, place them on your sides on your lower two ribs. And now we're going to take fuller breaths, but fewer of them. So in the last exercise, we were trying to breathe less air with each breath. Now we're taking more air, but over the course of a minute, probably be less air than you would normally breathe. So as you inhale, feel your ribs expanding laterally. We talk about breathing into the belly, but that's slightly different to engaging the diaphragm correctly. When the diaphragm contracts and descends, there should be movement in 360 degrees. The belly should move outwards. The ribs move out and then back in again on the exhalation. And there should also be movements into the back body. When we breathe deeply, it calms the body down. So the body feels calm. Biofeedback sent to the brain. And the brain tells the heart to slow down. It improves heart rate variability. We end up in a positive feedback loop of relaxation, stimulating the vagus nerve, which is what's sending this biofeedback, much of it back to the brain. Now, we've carried out these two exercises in order to just familiarize ourselves with the idea of breathing light and breathing deep. Now we're going to try and mix the two together. We're going to do something a little different. So you can rest your hands on your lap so you can relax a little easier into the breathing. Continue to breathe deep into the belly, feeling the ribs expand. And I'll just explain the exercise as it's going to happen. We'll do it a few times and I'll guide us through it. So we're going to breathe deep, big breaths, low into the belly, but fairly fast. We're going to do it about 5 times. And after the 5th breath, I'll tell you to breathe in, and then I'll tell you to hold your breath for 5 seconds. And at the end of the 5 seconds, you're going to exhale very slowly until you get to a neutral lung. In other words, don't breathe all the air out and force any air out. Just get to a comfortable position. And at that point, hold your breath. And at the first sign that you want to take another breath, start breathing again, follow that instinct, but go straight into breathe light exercise. So in other words, as soon as you feel the air hunger, start breathing very lightly, but try and maintain that air hunger. and then we'll maintain the air hunger for a minute or so, and then we'll repeat the exercise. So what I'd like you to do, we're going to be breathing a bit heavier when we do this, is just kind of start breathing a little bit faster, bigger breaths now, just to kind of warm yourself up to the idea. Then exhale, and then breathe in, out, in, out, in, out, in, out, in, out. Then breathe in and hold your breath for 1, 5, 4, 3, 2, 1. Then exhale slowly, 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 slowly to a neutral lung. And when you get there, hold your breath. The moment you feel like you need to take a breath, do so. But we're going to go straight into that breathe light. We're going to try and breathe a little bit less air and maintain that feeling of air hunger. So what we're doing here, we're at the beginning of the exercise, we're engaging the sympathetic nervous system. Not too much. I'm aware that it's the evening. We don't want to go too far down that route. And then we balance it with the breathe light exercise. We stimulate the parasympathetic nervous system. So breathing light and slow, trying to maintain a tolerable amount of air hunger. And we'll go for another round. So just drop the breathe light, breathe a little more deeply now. And then exhale and breathe in, out, in, out, in, out, in, out, in, out. Then breathe in and hold for 5, 4, 3, 2, 1. Exhale slowly till you get to a neutral lung. Then hold your breath. And at the first sign that you need to take a breath, follow that instinct, but try and ride that air hunger. Think of this as like surfing the wave of air hunger. To get the benefit of this, to get the benefit of the accumulation of carbon dioxide, you need to surf that wave. If you get washed out by it, in other words, if it gets a bit much, if it starts to make you feel anxious, or if it makes your breathing erratic, just take a step back. But also try not to sit behind the air hunger. Try to make friends with this slightly uncomfortable feeling. There's a Zen maxim which exists in many forms. One way of communicating it is, when walking, walk. When eating, eat. How present can you be with this feeling of air hunger right now? Breathing should be so light, so quiet. Okay, we're going to prepare ourselves now for the final round. So let your breathing grow slightly now, so it's not too much of a shock. Then exhale and breathe in, out, in, out, in, out, in, out, in, out. In and hold your breath for 5, 4, 3, 2, 1. Exhale slowly until you get to a neutral lung. Then hold your breath again. And again, you're waiting for just that first glimmer of air hunger, and then try and maintain that feeling by breathing light. How slowly and how quietly are you able to breathe whilst remaining in control of your breathing? Feeling the cooler air as it enters your nostrils, slightly warmer air as it leaves, and enjoying playing with this edge. This is your body's early warning system, one of them. We can make friends with it, and we can reap the rewards of treading along this line of air hunger. Okay, we're going to do another balancing breath exercise now, which you may have done before. It's called box breathing, also called tactical breathing. It's used by special forces and other military operatives before they go into situations that are going to be highly stressful. So they want to maintain a sense of focus, but also feel relaxed. So this is called a box because we breathe in for 4, then we hold for 4, then we exhale for 4, then we hold for 4. Again, this balances each branch of the autonomic nervous system. So I'm going to exhale and then breathe in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. Breathe in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. Breathe in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4, and in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4, in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4, in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. Last one, in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. Now just drop those exercises. Do one last thing to end this session. This is the physiological side. It's a great way of just getting the body to relax. It's very good for if you can't get to sleep or if you wake up in the middle of the night and can't get back to sleep. So what we do is we breathe in through our nose, nice big deep breath. Then we top it up and then let it go. And again, breathe in, top it up, let go. Breathe in, top it up, let go. And one more, breathe in, top it up, and let go. There we go. Maybe put one hand on your chest, one hand on your belly again. Check in and just see how you're feeling now. Is there a change in that feeling tone? Are your hands moving in any kind of different way? Perhaps if you were breathing into your chest earlier, you're now breathing a little more into your belly, which is how we want to try to breathe all of the time. Is to breathe low into the belly. And at rest, we want to be trying to breathe slowly and deeply, always through the nose. When you're ready, drop the exercise and feel free to open your eyes.